SCOPA.
Taking stock of the Limpopo Health Department's financial spending, top of SCOPA's questions was the department's audit outcomes. Measures to mitigate further wasteful expenditure were also ventilated. The committee was outraged by the department's written answers that stated that some findings by the Auditor General were erroneous.
We can't sit here as an organ of government and allow another organ of state or a department to attack the integrity of a Chapter 9 institution. And it is only happening in this department. All these other departments, they do not contest anything that the AG says.
The department, however, reiterated that it had a cordial relationship with the Office of the Auditor General, adding that it had written to both the AG and Treasury to request that audit outcomes about a 2010-2011 400 million rand infrastructure project should be attributed to the Department of Public Works instead.
414 million, which occurred 2011-2012 to during those financial years, was the infrastructure projects that was budget that were handed over to Public Works as an implementing agents. So when advertising those projects, they did not meet the 21 days requirement. So that is why they were audited and it was found to be irregular. But like I've indicated earlier on, it's not the way Honorable Maharaj was describing, that you spend 414 million on Sunday Times or on television.
MPLs also wanted to know why only 2 officials have faced disciplinary action for irregular expenditure.
They are the ones that are guilty. You give them a written warning. By the time we seated this committee to talk about those hundreds of millions of irregular expenditure, that thing has expired. Talk about that and tell us why you do a written warning one, and why is it done to only 2 officials, and what has happened to other officials that are responsible for the entire line of irregular expenditure.
The department, however, says it has been recording a decline in wasteful expenditure.
We have put our officials on terms in that regard to say that SCOPA has indicated that they are not happy with written warnings being issued, and therefore it means that the baseline sanction is going to be suspension without remuneration going forward. And we have heeded that call, hence we have given that notice to our members of staff. And in addition to that, we have given the instruction that we want a 0 irregular expenditure in the year 22-23, which is ended on the 31st of March.
The Limpopo Health Department reiterated that efforts to eradicate irregular expenditure topped its agenda, adding that in the last financial year, wasteful expenditure amounted to 9 million rand from a 23 billion rand budget. Biman Baloi, SABC News, Polokwane.